You are officially invited. Yes, you. You're invited to join us in Fertility Awareness Mastery. This is my 8-week program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start the second week of January. Are you ready to jump in? Head over to fertilityfriday.com/FAM to register today. That's fertilityfriday.com/FAM. This is a Fertility Friday podcast, episode number 346. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Journal. I'm a certified fertility awareness educator and holistic reproductive health practitioner with nearly 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormonal health, and optimizing the menstrual cycle without hormones. I'm outspoken about hormonal birth control and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys. I know, I'm a busy girl, but I managed to fit it all in. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with us today. Today's Fertility Awareness Reality Series is also a pill reality series. I feel like it's a crossover between the two. So in today's episode, I'm sharing my conversation with my client, Annie, who came on the show to share her experience with vulvodynia. And so vulvodynia is something that I haven't focused on a ton on the show, but certainly has come up. And I'll link previous episodes that touch on vulvodynia in the show notes page. But this is an important episode, an important conversation. And whenever I'm talking about vulvodynia, some of the themes that I think are important tend to come up. And one of them is the link to birth control, hormonal contraceptives, the very clear and obvious link that is often ignored by many health professionals. And hopefully we can, change that, continue spreading the word about that because it's frustrating. Many deep breaths are necessary. And the second aspect of it is just how challenging it can be to receive adequate support and care and really basically get the support you need to reverse this situation so that you can enjoy your life without the vulvar pain that is associated with this condition. So both of those themes come out in detail. Of course they do in today's episode. So without further ado, let's jump into my conversation with Annie. And I'm really excited to be here today with Annie. Annie is a member of my most recent Fertility Awareness Mastery group program. And I'm really excited to have her on the show to share her story and experience because we were just talking in the pre-chat. And Annie, I know your experience is one that I've touched on the podcast a couple of times, but hasn't come up that much. So welcome to the show.
Thank you. Really happy to be here.
Well, I'm excited to have you. And so I don't know, like I at some point I should just realize that it's run of the mill, but I realize that this is kind of one of the only places or experiences in your life where it kind of starts with like, so tell me about your first period, how old you were when that happened, but certainly give us a bit of background. So, when did you first start menstruating? What was that experience like? Have you used hormonal contraceptives before? And what led you then to want to choose fertility awareness at this point?
Yeah, so I guess I don't remember the exact date or year, but I would say that I started menstruating when I was about 13, I think. So middle school seems to ring a bell. And I think I didn't have too many issues with my periods. And then I decided to go on birth control later in my teens when I was about 18. And at that time I went on the pill, and then I basically was on the pill for birth control purposes, not for anything medical related to my periods, but I basically was on the pill until about a year and a half ago or 2 years ago. And so I'm 34 now. So that's a really long time that I was on the pill. In terms of like other birth control and my experience there, I decided a couple years ago that I wanted to try going to an IUD. It was actually an effort to kind of reduce my body's reliance on hormones, and so to go to like lower hormone levels. So I changed from like a regular pill that I'd been on for a long time and had no issues with to a Mirena IUD. And so that was like, let's see, it was about 2 years ago that I got the Mirena IUD. And this is all kind of leading up to how I got to where I am today. So after getting the IUD, I thought that I was taking a while to adjust to it. I had a lot of issues, well, not consistent issues, but sort of like random issues, or what I thought were random with the IUD. I would get some pain kind of what seemed like at random times, or maybe it was around when some sort of hormonal cycle was happening throughout, like in the middle of the month sometimes. And I would also get like a pretty serious like discharge at times. And sometimes I had cramps, really bad cramps. Actually, there were like maybe 3 times. I only had the IUD for about a year, but maybe like 3 times in that year where I had cramps like so bad that I had to like leave, like go home, basically, like couldn't even stand up. And that was like,
Sorry. And were those like with your period or just totally random?
I guess what I decided was maybe that it was, but it was difficult to tell because I wasn't really getting a period. It was like super light. And so I kind of thought my body was just like adjusting to the Mirena, and like things would like work out. And the discharge was like, I wasn't having much of a period. So maybe the discharge was like in replace of that. I honestly didn't know a lot and hadn't been provided a ton of information. I thought I was making the right, like a good step for me. So I had a few different issues with that. And after, I mean, sometimes too, I would have pain with sex that was like very sharp, like it would be like all of a sudden, like I got punched in the stomach sort of pain. And that to me, like, again, I had heard that some people had issues, or maybe it was like, I was worried if it was the position of the IUD. I had them check it. They said it wasn't. I decided that I would, well, yeah, so that went on for about a year. And so these sort of like random issues. And when I went for my annual checkup, I thought I better like talk to my gynecologist about these things because this isn't fun, right? And so I decided, so talking to my gynecologist, she said, I described like the sort of more intense cramps maybe around when I was getting my period, and then also the sharp pain and the discharge. And she immediately was like, oh, like you have an infection. Like that's not supposed to happen with your IUD. That's an infection. And I was like, oh, okay, well, yeah, like what do we do kind of? And so as like, I think a lot of people have experienced this, so it's just kind of a traditional of like OBGYN, they immediately suggested that they basically said it was bacterial vaginosis, they thought, after doing a test. And they suggested that I take an antibiotic. And so I took the antibiotic. It was like 5 days of like inserting it.
Sorry, I'm interrupting you. So you did a test, like they actually tested you, swabbed you, and it came back positive for bacterial vaginosis?
Yes.
Okay.
Yeah. And actually like my symptoms were pretty consistent with what that was. And so I was convinced that made sense. And so I took the antibiotics, and after I think about 5 days of the antibiotics, I got the bacterial vaginosis went away, we think, but then I got a terrible yeast infection. So I went from one end to kind of the other in terms of like the microbiome, I think. And so I then so this was about a year ago now. So I still had the IUD. So I got this bacterial vaginosis, and then treated for that, and then went to, and then got a yeast infection. And then had symptoms.
And have you ever had bacterial vaginosis before?
No. Okay. I had like no issues. Like birth control had been fine for me. I'd had a yeast infection like here and there, but not really. So yeah, it was like pretty different from anything I had experienced. So this yeast infection was really bad. It was like maybe one of the worst ones I've ever had. And so I went back to the doctor, and they of course said, oh, take diflucan for this. So they gave me a round of that. And basically what happened over the next few months was that the yeast infection, or some of the symptoms, like just didn't go away. So I kept going back and I kept saying, oh yeah, yeast infection. They were doing a panel, but they weren't detecting it, but they were still saying it must be yeast infection. It's probably just like in the early stages or like not detectable, kind of in like the lower range. And so I went through so obviously when you have a yeast infection, you're very uncomfortable, or any sort of symptoms like that. So I wanted to get rid of it. So I was doing all the things like, I cut out alcohol, I cut out sugar. I was trying to make like a number of changes that, because if it was my body that was kind of resulting in this, I wanted to figure it out. So I made a bunch of changes, nothing helped. I kept going back, they kept not being able to detect it. And I finally, just through talking to other women in my life, started to learn a little bit about like other things that could be influencing or kind of giving me that pain. The thing that about it being a yeast infection that didn't make sense is that there was like, after a few months into it, there was like no yeast. Like it was very dry. There was no irritation, like, and nothing visible or sort of like in the area. And so I didn't know really like what it could be, but I knew that it wasn't right. Right. So I eventually.
And sorry, can I,
yeah.
I keep interjecting. So in terms of the symptoms, because at first it started off being uncomfortable, being the BV, and then it went to yeast. And then now you're like, so for the listener who's kind of like, this sounds like something I experienced, what were some of the symptoms that you were experiencing when you were trying to figure out what this was?
Yeah. So when I had BV, I didn't have any of these symptoms. I just had like a pretty like funky, like smelly discharge, maybe every few weeks that I would notice. That was it.
I'm actually going to ask you to describe the discharge so that if you want to.
Yeah, no. So I guess it was like, they say like foul smelling, like that's
Okay.
that's really what it is. Like maybe like fishy smelling.
Okay.
And it was, the thing that was different about it was that I could smell it when it happened, like if I was sitting. Right. So it was like very,
it would just kind of like, so it's kind of like a gush of this stuff.
Yeah. And then it would smell it. Yeah.
Okay. Yeah. I think that's really helpful, especially for like anyone trying to figure out like, is this normal? Is it mucus? Is it not? And like that obviously is not mucus, nor is it normal.
No. Right.
And
I was just sort of dealing with it and thinking like, oh, this is because I got the IUD, like my body will work it out. And like, immediately as soon as I told the doctor I was seeing, they were like, no, that is not normal. Like that's why you go to the gynecologist, you go to talk to someone when that happens. So, okay. So yeah. So after that, the yeast infection symptoms were like pretty consistent, like, the kind of discharge consistent with the yeast infection, like itchy, sort of inflamed kind of feeling. But once I got into those months afterwards where like the symptoms were persistent, but there was no like discharge or yeast, it literally just felt like, and this is actually one of the hardest things about it. It was hard to describe, but I kind of got a little bit better at it after reading about all the different like ways you can hurt there. And so the feeling was kind of like, it was like irritated, like scratchy, sort of just like sensitive to touch. Like I basically did not want anything to touch me. Like, so pants, underwear became totally uncomfortable. Pants were unbearable. Sitting was unbearable. It was really hard because I obviously, like most people, many have a job where I have to sit, but I couldn't really sit for long periods of time. I had to like move around a lot, and I also couldn't wear pants. One of my like worst experiences while this was happening was I took a 11-hour flight or 8-hour flight to Finland. I've never been in so much discomfort as I was on that flight because I couldn't get out of my seat really. I could get up a little bit, but I was sort of stuck. And anytime I got like sweaty, or it would get worse. So yeah. So this sort of like not being able to wear pants, which again, like that for me was like the clearest sign that something was wrong.
Well, and it's not a yeast infection, because a lot of women are listening right now that have had yeast infections, and yeah, it's uncomfortable, and yeah, it's itchy, and you got like the cottage cheesy stuff sometimes, but certainly it's not to the extent that you can't wear underwear without feeling a significant amount of discomfort.
Yeah, right. And it wasn't like it was excruciating pain. It was more like I just couldn't sit or do normal stuff, which in some ways was like even more debilitating, to like it just so yeah. So that was going on for months. And I had the idea that maybe it had something to do with my IUD. So I went back to the doctor and said, could this be a result of having my IUD? They said no. the infections, like, right? They said, no, it wouldn't be like, it's possible you got the infection while you got the IUD. And I was like, but I never had any of these issues before. Like, couldn't this be related? They said no again. And I just said, well, you know what, just in case, like, let's just take it out, right? Like, let's just get rid of it. So I had it taken out in like a few months after dealing with these symptoms for a few months. I was hopeful that that would like fix it and things would go back to normal. I immediately went back on the pill because I wasn't ready to like not be on the pill. And I had been fine with the pill before. So I thought that'd be okay. So in this time, like, reading and learning and trying to figure out what could possibly going on, I was seeing an acupuncturist. I have been going to acupuncturists for other reasons for a while. And they suggested that I maybe look into some sort of abdominal massage or see a pelvic floor physical therapist, because maybe they said some of the pain could be related to muscle tension in that area and not this like sort of surface, not coming from an like irritation or, and so I went to see a pelvic floor physical therapist, and then began like this last 8 months of working with people, I think, who are more familiar with these types of symptoms, but it still was a bit of a journey. Yeah. So I didn't realize my story was going to take this long, but there's a lot of detail.
Yeah,
right?
no, I think that, see, the thing is that it takes as long as it takes. And there are women who are listening right now who have experienced something similar or have experienced some degree of, whether it's pain with sex or pain in general in that area. And certainly there's a certain percentage of all women who experience an increased level of pain or discomfort in their vulvar area, specifically and directly due to hormonal birth control. So it's not like the most common side effect, but certainly it is a side effect that we would all be better off knowing about.
Yes.
Period. End quote.
Yep. No, totally agree. So and at this stage, I didn't even like, the connection had not been made to birth control for me, right? I thought this was more like a result of having an object inside of me. And like maybe the fact that I had been in pain and had that bacterial infection for so long had caused my body to kind of like be in this state that it was sort of stuck in. So I started seeing a pelvic floor physical therapist, and she recommended that I see a urologist who specialized in a condition called vulvodynia. So I had never heard of vulvodynia, but pretty much immediately reading about it, I was like, yeah, this is exactly what this is it. Like, there are two different kinds. There's like a more localized and then a more sort of general. I'm forgetting the names right now. But for me, it wasn't like one place where there was pain. And some people have like pain at the opening of their vagina, and it wasn't really that. For me, it was just like this general, like all over in the area. And this like complete discomfort with like any material or anything touching me. And again, not being able to wear pants. So that was helpful. I was able to get tested. They have like a Q-tip test that they can do to sort of like test your sensitivity in the area. And I got a diagnosis for that from this urologist. And then came like figuring out how to treat it. So at the recommendation of this doctor, who was like really helpful and at least like confirming that something was going on. And he was also like really trusting that the pain was real and it wasn't something I was making up, which I really appreciated at that time. He suggested that I try going on a antidepressant that's like they give for really low level nerve issues. And the sort of thinking was that I had been through these extreme infections, and the muscles in the area had tensed up to a point, or had been tense for so long that the nerves were firing when they shouldn't be.
See, okay. I'm sorry. Like, okay, so someone is probably going to disagree with what I'm saying, but like, I obviously have a different perspective on this stuff, so I'm going to share it. And like, I'm hearing you say these things, like they're making this huge explanation of, it was so traumatic for your body to have these infections that now you have just systemic muscle tension. And not one person is aware of the fact that hormonal contraceptives can change how your body produces hormones. And our vulvar tissues are extremely sensitive to testosterone. Hormonal birth control significantly suppresses it. And for many women, it results in a thinning of the tissues and therefore a hypersensitivity. I mean, I tend to have the approach, and because you're in the program with me, that I don't
Right.
like to jump to the conclusion. It's almost like, is it? No, I can't remember the word, but it's like that the phrase, and I can't remember the phrase, but it's like the simplest explanation is often the explanation. So before we jump through all these hoops and assume you have a psychosomatic condition, can't you just ask the question of like, when did this thing start?
Yeah. Right.
And like
Yeah.
what change? Because this is how you have seen me say that to basically
Yeah.
every person in their hot seat. Oh, so you had this change. When did it change? Did
Right.
anything happen around that time? I mean, literally, this person is like, I'm going on a tangent, but like literally, this person is like, you had this whole thing going on with the muscles and tension and trauma and all of this, and not one time you can't just say, when did this start? What
Yeah.
was different? Now, it's not always going to be that simple, but for crying out loud, it's not like you had a history of pain. So I
Right.
apologize for the little mini ranty in between, but literally it needed to happen.
Yeah, no, and I think what was a little bit confusing was that it didn't happen like right away when I got the IUD. And it didn't happen but it was sort of, yeah, it was obviously that was the big change, was like changing the like I went from birth control to getting an IUD, and then all of these issues sort of started happening. But that the kind of all over like surface pain didn't happen until after those infections, which I think kind of maybe threw them off a little bit. And that was maybe why that was what the doctor was kind of, that's what he thought. So I'll fast forward, because then COVID, then the shutdown, a lot of, fortunately being able to wear comfortable clothes in my apartment and being in pain wasn't as bad because I didn't have to be at work every day in the same way. Stopped working with that pelvic floor physical therapist because everything shut down, and I kind of I went on the antihistamine and the antidepressant, but I really didn't see improvement. And so it wasn't until I started to notice that my pain would be worse in the beginning of my cycle versus when I was like taking the blank pills, and like after my like fake period on my birth control, I would always feel better. And I started to see that pattern over months. I was always feeling better when I was taking like the blank pills, and then it would get worse as soon as I started my next pill pack.
Interesting.
Yeah, I did like a bunch of things. I like was tracking my pain. I was writing a journal. I was like trying to get rid of stress. I was like doing, like I thought I had this chronic condition that was, like not going to go away until I dealt with everything else.
Well, because they made it seem like it was. So you can just hear that part of me being frustrated. Like, so I'm just going to say, like, they put you on antidepressants because you were having vulva pain. And they basically suggested that it's essentially a condition that's emotional. If a man has penile pain, do you think they're going to put him on antidepressants and suggest it's because of his emotions?
Yeah, no, it's pretty messed up.
Okay.
Yeah.
Like it has to be said. Like it has to be said. And that's why I say it, because we can sit here and pretend like that makes sense, but it doesn't.
Yeah, right. No, if at any point anyone had told me to go off birth control, I would have gone off it in a second. It's not an issue. I could have
just to try it out, right? And if it doesn't get better, see, this is literally like how I live my life. It's like, okay, so try something, and if it works, like this is the whole concept of the menstrual cycle as a vital sign. Like if you see a problem and you think, okay, it could be this, it could be that, you try it out and then you see. And so this is, again, I'm going on a little ranty, but this is a theme that has been through all these podcast episodes. So another example of that is the depression that a lot of women feel on birth control, and the actual scientific evidence that shows that teenage girls who are on hormonal birth control are much more likely to be on antidepressants. And so instead of the doctors saying, we know there's a link between hormonal birth control and depression. So since you're on birth control and you're having these symptoms, let's just, go off of it for 3 months and see if they improve. And if it doesn't improve, then at least we can know that it's not related to that and we'll address it differently. This is logical.
Yep.
But instead, let's just put you on 2. So now you're taking 2 pills.
Right. Yeah. So that was a lot. In one time, like it was like it was a very low level. As I understood, it wasn't like the amount that you would put someone on like for depression, but it was still, I'd never been on anything like that in my life. And so, but honestly, I just wanted to feel better, right? I just wanted to be able to go through a day without constant discomfort. I was saying, like, I started to notice that there was a relationship between like the part of my cycle I was in and my pain. And then had started to see a new pelvic floor physical therapist who was actually really wonderful in like talking about all the different things that could contribute to this and like all the possibilities and how everything is connected. And she was really surprised to hear. So she was like, so who's the gynecologist that you're seeing? And I was like, oh, I'm not going back to my gynecologist because that didn't go well, right? They kept telling me I had a yeast infection. She was like, oh my goodness, like you should see the specialist here. And so she recommended a pelvic pain specialist in the practice where I was going for physical therapy. And it wasn't until I saw this doctor that like things started to click a little bit. So I saw the pelvic pain specialist, and she agreed that it was a possibility that the scenario that the other doctor had told me was true. Like maybe that was how I'd gotten to where I was. But she also said to me, she basically said, okay, so if I didn't know anything about the IUD, these infections, like everything you've been through in the last year, and you came to me with these issues, I would basically just ask you one question, which is, how long have you been on birth control for? And she was like, and you've been on it for a while, like over 17 years now, or 16 or 17 years. And she was like, and that is like, I am not surprised at all considering how long you've been on it, that you would be having these issues. She said that she's seeing it a lot, like it's really common, and at least in the patients she sees, which she also acknowledged were like totally biased because she sees people who have pelvic pain. So she's seeing all the people, the women with these issues. But she said that basically she's seeing a lot that women have this like kind of increased sensitivity of their vulval tissue. And so it wasn't, I think I've read a little bit about like the thinning of the tissue, and that the main thing she said was that your hormones regulate keep that area comfortable. They regulate all the moistness and and they're starting to see that women who have been on birth control for a very long time, like their bodies are losing the ability to kind of keep that area the way that it should be.
Yeah, kind of like what they talk about in menopause. And so this is why it's important to kind of understand how, you weren't exactly like, you're in your 30s now, but there are women in their 20s who then have vaginal dryness and discomfort, similar to what we would think of as being typical for a woman who's literally going through menopause. And there's a reason for that. And so we know that the birth control pill suppresses your normal hormone production because it needs to in order for it to work. And so that means you produce significantly less estrogen, progesterone, and testosterone, like your own natural versions of that hormone. And so it obviously affects women differently. So the actual effect that a woman will experience is not going to be the same across the board. But from a hormonal standpoint, every woman on birth control is going to have a significantly lower output of her natural estrogen, progesterone, and testosterone. And those hormones, particularly testosterone, are crucial for, it's like exactly what you said, maintaining a healthy, happy vulva.
Yeah, so that seemed like it was wonderful to have someone like know about it and be like, this is happening. This is really common. Like and her advice to me was like super simple. She basically said, you should just try going off birth control. Like, just try that. She said, if you really don't want to, like, you could try a progesterone only birth control. There are other options. And so I weighed all my options. And at this point I had, been on the two other, the antihistamine, the antidepressant for a long time. And I just was like, I just need to give my body a break. I need to just wean off these other drugs, just see what happens, like it naturally. And so I've now been, and then I was in part of that, like, I think going off birth control was really scary for me. Like, even as in my 30s, I have the same fears as I did when I was a teenager. Like and that's a whole other discussion of kind of issues with the way that we just instill fear in women around, like if they were to get pregnant and it wasn't planned, that would be the end of your life. Right. Like, and here I am, like an adult, like fully, I'm allowed to get pregnant. Like I'm old enough. I can do it when I want to. I could, if it was unexpected, it would be okay. But I still have this like fear and kind of shame around that, which is something I think I'll continue to deal with. But anyways, I was scared. It always been kind of a crutch for me, birth control, like just like one less thing to have to worry about is like the possibility of getting pregnant and my whole life changing. And so that's why I decided to join your class, because I knew that like having some guidance and having a support group, for me, it was like a support group to just like have women kind of share the experience with me and know that I would have a community to go through this with. Yeah. So that it's been now like 3 months, I guess, since I went off birth control. I went off everything else. And this is probably not, I don't think this will happen for everyone, but almost like immediately. So I said, like, when I wasn't taking birth control, I always felt better. So like since my last cycle, or like immediately after my last cycle on birth control and into the next month, not taking the next set of pills, I felt better, like way, way, way better. And I now basically I went from 20 to 30 days, maybe 20 out of 30 days of the month, I would have pain. And that would be like varying levels, but like general, like low level discomfort the whole day, like having to fidget in my seat, like not being, and having to wear skirts, not really being comfortable in jeans, not being able to wear jeans almost at all, to now like maybe like 5 days top out of the month where I have discomfort. And I'm trying to figure out now, I think I'm just trying to like work on developing a healthy cycle and hoping, my doctor said that it would take probably a little while for my body to kind of get back to normal. So I'm hopeful that it'll continue to like kind of diminish in the coming months.
Well, that's a significant improvement. I remember we talked about this pretty much at the beginning so at the very beginning of the class, everyone introduces themselves and just shares a little bit. And I really appreciate you, Annie, taking us through your story. I mean, it's a lot to have to deal with. And just from listening to your experience, this is the kind of thing that affects your day-to-day life all the time, all the decisions you have to make, from what you're going to wear to how you're going to sit to whether or not you can go to work. These are the things that, although they're not on a headline on a newspaper, these are the types of things that affect our daily lives and have this huge impact. And and they also have an impact on our intimacy and things like that, and like how comfortable you can feel overall just in your own skin and in your body and things like that. And obviously I couldn't even hold my tongue to like jump in and be like, but regarding the way that it was looked at, but it's unfortunate. That's why I keep sharing these stories. And that's why these episodes are my favorite, because this is what it really looks like for women. Yeah. And if someone, I don't know, wanted to binge on just the reality series or the pill reality series episodes all day, by the end of it, you're going to feel a little bit frustrated, but also heard, because so many women have this experience where either they're not even taken seriously at all. So that's always a possibility. Or if they are, it's highly minimized. And I mean, the doctor who supported you obviously was doing what they thought was best. And it's not to throw a ton of shade, but at the end of the day, like, are you kidding me? Right. And the fact that so I already shared my thoughts about that, but the fact that what they suggested didn't work. Right. But you felt like you continued to try because you didn't really know what else to do. Yeah. And meanwhile, obviously, the answer wasn't so simple. And so, I mean, of course, the question is why. And I think this is one of the challenges with birth control side effects, because some women go on birth control of varying types and they have a side effect immediately. And other women go on that birth control and the side effect kicks in 5 years. So I've certainly interviewed women who have panic attacks and anxiety and things like that really kick up years in. And so you're not even thinking that it could be related. And there was something that you said quite earlier on that I wanted to just put out there, because at the very beginning you said, and it's just such a, like, the life is so crazy sometimes, because the whole reason from what you said that you switched to the IUD was because you were trying to wean yourself off of the hormones and you were trying to get a lower level. And I've said this on the podcast before, I'm sure in the Pill Reality series, but one of my pet peeves is the way that we talk about the IUDs. So the progestin containing IUDs, because I don't, but it's very common for health professionals to say things like, oh, it's a low dose. Oh,
Right.
it's localized in the uterus, so you're getting less, as if you don't have a circulatory system. If you were waiting for the last minute, it has officially arrived. Fertility Awareness Mastery Live starts next week. Fertility Awareness Mastery is my 8-week group coaching program that is designed to help you unlock the secrets of your menstrual cycle. It teaches you everything you need to know about using fertility awareness cycle tracking to achieve your intentions, whether you're currently trying to get pregnant, avoiding pregnancy, or planning to conceive in the future. And the best part of the program is that you get to join a community of women who are all focusing on charting and cycle tracking. This program goes deep. Get to the root of your period problems, hormone imbalances, fertility challenges, and so much more. Head over to fertilityfriday.com/FAM to register today. That's fertilityfriday.com/FAM. Now let's jump back into today's episode. And so sorry to burst your bubble. So certainly with the progestin containing IUDs, you're not getting the synthetic estrogens, right? So it is a bit different. But to say that it's low dose, what does that mean? Because the dose has to be high enough to prevent you from getting pregnant. So legitimately, what does it mean? Like lower than what? Higher than what? And also, it's not localized. The progestins do not stay in your uterus. So just in case anyone doesn't, for everyone listening, spoiler alert, the progestins don't stay in your uterus. Just like if I put lotion on, the xenoestrogens in it doesn't stay on my skin, right? Yeah. So can we just stop saying stuff like that? Because then you took it with the impression that it was going to lower your hormone levels, not simply expose you to different types of synthetic hormones, which could have a different effect. And unfortunately, in your case, maybe it just exacerbated because it's certainly possible, like your pelvic floor physiotherapist. Yeah. What she suggested was that it could be the compound effect of all those years. So it's certainly possible that it could have been the trigger, but certainly, we just don't know.
Yeah. Yeah. No, it's been quite an experience. It's kind of crazy to me that it took so long to get such a simple solution. Yeah.
Well, so this is the long segue into so what brought you to fertility awareness? It's well, it's funny that you ask.
Right. Yeah. Do you have time? Because I have a lot to tell you.
How long you got? Because I'll tell you what brought me to fertility awareness. So then share with us. I think also, I just want to highlight something else that you said, because I think it's so, so important. And what you said was, I'm an adult. I can get pregnant if I want to, but I was still just as terrified of getting pregnant in my 30s as I was basically in my 20s. And this is something I think that as we get older, all of us as women have to start to have these conversations with ourselves. Because I feel like there's certain things in life where we make a decision, once, and then that decision we just stick to just because we made it. So you made a decision when you were 19 to go on birth control, and you're not questioning it. The decision is made. It's handled. Right. So you're not really checking in on that. And certainly what we don't consider is that everything isn't the same. So if you're 25, you're not 19. If you're 30, you're not 19. If you're 35, you're not 19. And so at some point, it doesn't mean that your decision has to change, but at some point you should ask yourself, in my opinion, is this still the best way? Is this decision still feel right? And ask yourself the question of what would I do if I got pregnant? Because the challenge with hormonal contraceptive, I think, or all of the kind of long-acting methods also, is that because it's handled, air quotes, you don't even consider the possibility that you could even get pregnant. Because sometimes the methods fail and you do get pregnant. But sometimes if you were 19, you would handle that unexpected pregnancy in one way. But if you're, 30 something, you would handle it in a different way, but you've never actually thought about it because you just never revisited that idea.
Yeah, and there's no prompt to revisit it. It seems like something that you should discuss with your gynecologist probably every year, right? One of the things that was really helpful for me during the course that you did was you said that everyone, that you and your partner should, like, kind of on a scale of 1 to 10 or 0 to 10, I forget, figure out like where you are in terms of like not wanting to get pregnant and wanting to get pregnant, right? Like, and so for me, I'm a 1 or a 2, but like that has probably changed from a 0 when I was 19, right? And so what you're saying is like we can then adapt these like major things that we're doing to our bodies, you know, in light of like where you're at with that. Yeah.
Well, because it's complicated. And I think this is the part that people don't want to talk about, which is why I talk about it. Because so for example, if you're 19 and you're just in a certain situation and you've kind of made that decision that I would, terminate if I had a pregnancy, right? Because there's a lot of women in that circumstance. It's possible that when you're no longer in whatever circumstance that is, maybe it's a particular relationship, school, whatever, but maybe when you're 27, if you were to legitimately get pregnant, you would keep the baby.
Right.
Or maybe at 32, something would change and something's different in the relationship and you wouldn't. And I recognize that there's all different people living out listening to the podcast of all different opinions around this particular topic. So I'm just giving it as an example to show that it can change and it can shift, and it can shift without us really thinking about it, because often, because of the way our culture deals with birth control, we're not really thinking about those things. And I'm just saying it's time for us to start thinking about it, especially because there's, you saw it in the class, because a lot of the ladies in the class were coming off of birth control similar to yourself. And
right.
so you didn't get to see kind of, because the class isn't like 6 months long. So you didn't get to see what's on the other end of the transition phase of birth control. I've certainly seen that. But what you did see was that, well, you kind of did, because there were some women who also had, not taken it for a long time. But what you get what I'm saying. So there's a transition period. When you chart, you see it. The mucus patterns take a little while to normalize. Sometimes the cycle length, sometimes the luteal phase. And sometimes you have all these different symptoms. And of course, it feels overwhelming because you just came off of birth control, and it's fine. We can work through it. We talked a lot about how to minimize that. And that's very helpful, obviously, to kind of like truncate some of those experiences. But you can't get rid of the transition period. You can try to supplement it away or whatever, but you can't. And so this is another reason why it's important to revisit your choice of birth control, because what would have worked when you were 19 might not work when you're 32, because one of the important parts of that discussion around like, where are you on the intention scale, is that you can literally go from a 0 to a 10 in like a couple of days. And
right.
So if you doubt what I'm saying, just think about those ladies who are waiting until they get married to get pregnant or to start trying. And so literally like May 24th, not trying to get pregnant, May 25th, wedding day, damn, like bam, like I am ready. Yep. And so I see this in my work. I see it. I see women switch on a dime. And so the challenge is, if your birth control method doesn't allow you to switch on a dime, you emotionally can switch from a 0 to a 10, but your body can take 9 to 12 cycles to normalize post-pill. Right. But it kind of going back to the initial point was, I just really liked that you said that, because we also live in a culture that really much discourages pregnancy in a lot of situations. And it is what it is. It's a challenge. And I think that not all of us are encouraged to have those conversations and to realize what you said, which is that there comes a point in your life where it might actually be okay if you got pregnant. And sometimes we don't realize that has arrived. And I'm not trying to be judgmental, so please don't take me the wrong way. I'm just saying that many women don't realize, like, sometimes you actually are at that point where it would be okay. It wouldn't be the end of the world, but you haven't really thought about that.
Yeah. Yeah. My sisters and I have 2 sisters, and they've both been really supportive through this process. What we talk about a little bit is how we have been afraid of getting pregnant our entire lives. And now we're in our 30s, and all of a sudden we're supposed to want to get pregnant, right? Like what, like, how are we can't do this, like, yes, we want to be married, we want to be, but like that shift is like, even just preparing for that is like, it just seems like we're just supposed to like all of a sudden not be scared of it. Like, so I think we're trying to have conversations to like prepare ourselves a little bit for it, and just not be, and like deal with that fear that I think is like society has put on us.
Well, and from a practical standpoint, I think because that's more of like legitimately just my observations, because I see I've just, I've been around long enough and I've had enough conversations to see that this is a complex issue. And this is exactly why I think it's a good idea to have these conversations. But a bigger part of it from the practical fertility awareness standpoint is kind of like meandering back to the fertility awareness part of the conversation, is that it's a good idea, if possible, to decouple this idea of being off the pill means I'm going to get pregnant, because that is not necessarily the case. And I think and I've spoken about it and I continue to speak about it because I see it in my work, but it's just this consistent, I'm not that much older than you actually, but Annie, you're like yourself and younger, like the younger generation, the younger ladies coming up. Certainly it's the fear God was put in you guys.
Yeah.
It's just, and it's hard. It's really hard to just kind of ease into a different way of doing this. So my hope anyways, well, I mean, let us know. So this was what brought you to fertility awareness. Yes. Because this hormonal contraceptive thing was no longer working because of the discomfort that you were feeling. And certainly your experiment of coming off of it had a positive effect. And you still have some of those days of pain, as you mentioned, but certainly going from like 20 to 30 days to 5 is a pretty significant improvement and the most successful option that you have tried thus far, for sure. So, but that doesn't mean that you wanted to get pregnant when you stopped taking the pill. So tell us, how did you manage the fear?
Well, like I said, it was really helpful to have the support, just the group of other women who were also tracking their cycles and learning at the same time. Just to kind of know I wasn't alone. I know I probably could have joined some online community or something, but actually having real stories of other people and people faces and forming those relationships was really helpful. And yeah, I think once I started to see the data, so I'm actually a data scientist in my career. So I had a friend also say to me, when I was talking about maybe going off the pill and starting to track my cycle, she was like, Annie, you're a data person, that'll be great. It'll just be interesting. You'll learn, so I do have to say, starting to see the data. So I, getting to look at other women's cycles also, but doing my own tracking and just even temperature has been it's really comforting to me to see that I can see a pattern and then I can trust that pattern. So, and obviously I need training to learn. So just I think just starting to see the patterns. And so the repetition, I think I'll need a few more cycles at least before I'll be comfortable. And it's also really nice to know that I think I always felt I'm using multiple methods. So I'm being extra cautious. So now to be able to trust the fertility awareness as a method, in addition to what other methods that we're using for protection, is just I feel I'm doing as good of a job covering my bases. And so it hasn't actually been nearly as scary as I thought it would be. And I feel so much better. And I'm just relieved because I think, I would like to have a family someday. And so to also feel I've started the transition to being in a healthy place so that when I do decide that I'm ready, my body will also be ready. And so feels like the right move. Yeah.
Well, yeah. And thank you for sharing that. And I think certainly it is possible. Women do this, charting thing, and they do it successfully. And as long as you understand how to manage your fertile window, as long as you understand how, the rules of whichever charting method that you use, and as long as you are clear on your intentions and, you and your partner have sorted out how you're going to manage those fertile days, because you have obviously pulled the goalie when you're not on a hormonal method or you don't have an IUD inserted or something like that. But it's doable. And that's also part of the reason I like to share these stories so that, women can hear, you can do it. This is doable. Sure, you got to take some time to learn it, just like any other important skill, but it can be done. And this is also, I suppose, helpful for me to share, to have the opportunity to, I guess, give you the platform to share your experience, because unfortunately, I hear stories like yours all the time. And I was saying in our group call that, good thing I have the podcast, or I'd probably be standing on the street somewhere screaming at somebody because I'd be so pissed off that women have to continue to go through all of this stuff, because it's just, it's not rare. So Annie, you might feel like your experiences, everyone doesn't have vulvodynia, and have your experience, but you might feel like, oh my goodness, like, I don't know, anyone personally who's had this experience, but there are women listening who have, or something similar. And it's a lot more common than we would think. But the only challenge is that where would you even hear, like,
right.
how would where these women who have these experiences, where do they really have to go to explain it? It's usually if you find an online group or a blog or something where you actually, that those are kind of our modern day ways of connecting. But yeah, rest assured, you're not the only one that has had an experience like this. So, go ahead.
Well, I was just going to say, and that's part of why I wanted to do this, like come on your podcast, because listening to your other episodes about this issue, even though the stories were a little bit different from mine, like that in itself was really comforting to me, because I was like, oh, okay, there are other people and there's someone who's talking about this and someone who knows about it. And also like being someone who like, I really trust like the research process and believe in, that we kind of need to see something consistently, and we need to study it. It needs to be studied. Like there needs to be real scientific research in this area. And I guess I have a number of thoughts about that, but like that this is really a start to pushing for that. Like this is like collecting the qualitative stories is really important to like making a case for the scientific community to focus on these issues. And I think that like for sure my generation is probably, we have way more women who have been on birth control for a long time now. And so some of this stuff is kind of new. And, and I think like, hopefully just you continuing to talk about it with people is going to only help like push like that this should really be a priority. So that then I don't go to a gynecologist and they don't know what I'm talking about, or they don't know that.
Or they call it an emotional issue. And so this is part of, so I'm still on that. Apparently I can't let it go. But this is one of like, if there was one hope that I had for doing these types of episodes, just one, it would be that at least doctors who deal, not just doctors, healthcare professionals in general, who deal with painful sex, vulvodynia, pain in the vulvar area, sensitivity in the vulvar area, hypersensitivity, etc., at least have it on their radar that it could be related to hormonal contraceptives. Like that is like one of the bullet points on the possible reasons. Because obviously it's not always going to be related to it. But at what point are we going to stop assuming that it's psychosomatic? So, that I don't know. So if there was one thing, it would be that. And certainly it would be nice to shift. I understand the importance of the scientific process. But the fact that there's little evidence, right. For example, I'm not even saying that that's the case, because there are research studies about the link between birth control and pain and stuff like that. Obviously not as much as we would like. But my point is that the lack of evidence in and of itself does not prove that something doesn't exist or that there's right. no link. And so, but unfortunately, we often look at certain cases as anecdotal and we don't really give it a lot of validity. And so, that's why I'm here. I mean, the podcast you can't really say a podcast is scientific, but if you interview a bunch of women and they just tell you their honest stories, are you just going to ignore it, or are you going to actually listen? It's up to you. Like the choice is yours.
Yeah. You're like aggregating a whole body of stories that, that prove in a way.
Well, and I don't have to prove anything. Like you listen to the story and then you make your own decision. I feel like they speak for themselves. And obviously the point is every woman's story is unique, but there are a lot of common threads. And unfortunately, those common threads are often not being believed, not being understood, not getting, the right diagnosis or treatment right off the bat, being minimized, and kind of one of the themes, I mean, fortunately, in your case, you managed to be steered to a practitioner who was able to kind of at least point out one of the most significant contributors. But for many women, it's literally like midnight Google searching to find an answer. And we got to do better. We deserve better than a midnight Google to find.
Yeah, I mean, I did a lot of that too.
Well, of course. Sure. But think about we have this whole gigantic medical system, trillions of dollars, and I have to go to Google to find my answer. And then Google tells me, I shouldn't even say, I don't even use Google anymore. The DuckDuckGo tells you, but you know what I mean? Anyways, so I will leave that there. But as we wrap up today, I mean, we didn't get to any fertility awareness knowledge. Usually we get to a couple of questions, but I think that's okay, because I feel like it was really important to spend some time really going through your story. And of course, these are my favorite episodes. But as we bring our episode to a close today, for a woman who is on birth control, didn't have the same challenges as you, maybe didn't even have side effects that she was aware of, but she's thinking about transitioning and she's totally like with you in terms of the fear part of the conversation. What, if anything, would you want her to know?
I mean, I think I already said it, just that and also I've had this said to me, but it took some convincing. Just that, yeah, you can do this. There are many women who are doing it, and also and you deserve to make that choice about what you're putting in your body. And yeah, it's really not even that hard. And the other thing is you learn all these other things about your body. And that I think is super valuable. The way that you talked about, it's just kind of, it gives you a pulse on your total health. If something is wrong, your cycle is going to be wrong. And so it gives you a way to kind of monitor your whole body. And that I think is incredibly valuable. And yeah, and it's also it's cool. It's kind of fun. It's neat to, so really not that hard. And so I was intimidated, and I also thought it was old school kind of, I come from a Catholic, it was raised Catholic, and I was just no, that's what they used to do. That's not but it turns out our bodies are kind of the same, similar because they've always been, right? And yeah, and there's and a lot of people have figured this out, and so yeah, so you can trust it. And yeah,
I love that. That's really awesome. I love that you said that. It's interesting because yeah, our bodies are there's some differences because of the pollution,
yeah, no,
etc. Right. But our general physiology is actually the same as
yeah,
grandmas who
yep.
potentially used these methods. Well, thank you so much, Annie, for being here today. This was such a treat. So thank you so much again for sharing your story. And I'm really excited to share this episode with the listeners.
Thanks so much, Lisa.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/346. I hope that you enjoyed my conversation with Annie. I mean, what a powerful story. So thank you once again, Annie, for coming on the show and sharing your experience. I mean, vulvodynia is becoming more common because you have, as Annie was sharing, more women who have been taking hormonal contraceptives for a long time. And many women are affected by the drop of hormones that they experience while on contraceptives, particularly the drop in testosterone. And I think one of the most compelling parts of Annie's story was when she shared that essentially, I mean, you can read it however you read it, but when she was sharing that, her doctor concluded that the infections that she had, which, I mean, she didn't have a history of chronic infections, and she got this infection shortly after she had the IUD, so it indicated that there's a possible connection. I mean, at least we can't say for sure, but certainly if you've never had episodes of bacterial vaginosis and all of a sudden you have it and it corresponds with when you had your IUD, I mean, you can't rule that out, that could literally be the cause. But the doctor concluded that the experience that she had with these infections somehow caused her to have such severe stress in her body that it's now causing constant pain. And at no point did the doctor even ask, could it be related to birth control? And I think that's more of a systemic issue because many practitioners are not necessarily trained about all of the different but very common side effects that women experience. And that has been my experience when I do interviews with doctors. But I suppose the most frustrating aspect of that is essentially the doctor looked at this physical pain that Annie was experiencing and attributed it to an emotional cause, essentially saying that he's essentially thinking that she's really stressed and tense, and it's really just, you just need antidepressants. And so there certainly could be something I don't understand about the application of antidepressants in a situation like this. But on its face, it kind of looks like, what do you mean you're putting someone on antidepressants when they're complaining about pain in a specific area of their body? What is that about? And if a man had pain in his body, would you be putting him on antidepressants because you think it's an emotional issue? And then it didn't actually work. And it turns out that the most effective strategy and solution that Annie has, adopted thus far has been to just try coming off hormonal contraceptives. And so I can still remember our first call together as a group. It's shortly after Annie had come off of contraceptives. And, she, for the first time in a very long time, had significant relief from the pain. So this is just, I felt the need to just highlight that aspect of our call, to share the encouragement that I suppose I've been sharing, since the beginning, which is trust your intuition. And if you are experiencing painful symptoms and your practitioner isn't taking you seriously, or if your practitioner recommends something but that recommendation isn't actually working and you're not really experiencing any improvement or benefit, don't fall into this trap of thinking that it's in your head. It's not. If you're the one who knows more about your body than anyone else ever will. Regardless of how many degrees are on the wall, you live in your body every day. And so you're the one that really is going to know the most about how you feel and what's normal and what feels off and those types of things. And it is challenging in our current medical paradigm to actually get that support for a variety of reasons, as we've talked about on the podcast, various episodes over the years, not least of which that sometimes your practitioner is not necessarily connecting, like making that connection between hormonal contraceptives, even in the case of having that bacterial vaginosis and being then put on medication and then it causing the yeast. Many women have that type of reaction when they go on any type of birth control because of the effect that it can have on your vaginal microflora. And again, that's not always the first thing that your doctor is going to tell you. Oh, this may be a reaction to the hormonal changes and shifts, changing the vaginal microflora. It's typically, here's a prescription for an antibacterial or an antifungal. So it's really up to us to advocate for ourselves, really get the care we need. And I think that Annie's experience really shows that for some women, fertility awareness is, an option for a variety of different reasons, but for others, it can mean the difference between, living in pain and having really significant negative side effects versus being able to overcome those. And of course, there's an argument to be made. Okay, maybe some women are more sensitive to hormones and all those types of things, but hormonal contraceptives affect all women. The way that they work is by suppressing our natural hormone production. So it's not a question of, if it's going to affect you, it's a question of how is it going to affect you. And so not everybody experiences the same symptoms, but I think it's important to know, like if you do a blood draw and a woman's taking hormonal contraceptives, her testosterone is going to be extremely low, 50% or, lower than a woman who's not on hormonal contraceptives, so 50% or more lower free testosterone. Her natural estrogens that her body produces and natural progesterone that her body produces are going to also be very low. And these hormone levels most resemble the hormone levels of women who are in menopause, so past the point of ovulating normally. And so, of course, they don't put on the pill pack. Hormonal contraceptives put you into a state comparable to, an artificial chemical menopause, because, of course, that's not going to roll off the tongue and result in heavy product sales. But I feel like it's always important for us to just understand. So it doesn't mean like never use the pill or it's bad or it's good or whatever. It just means that it is what it is. It does what it does. And we at least should be aware of that, so that if we do experience certain symptoms that are related to these changes, we can at least be aware. And so I'm always saying basically the same thing, because someone has to, and someone has to put this information out there, because in many cases, it's forums like this, podcasts like this one, blog posts, forums online, different groups of women who have had similar challenges. It's often those kind of community, basic kind of level communities and women who are getting together and sharing this information independently. It's often those types of sources that are really the respite for women who are struggling and can't get answers through the regular medical paradigm. So I felt the need to take a bit of time and kind of go through some of those things, because for whatever reason, that aspect of Annie's story really, really struck me, because it's such a stereotypical, it's got to be emotional type reaction. And I just really don't resonate with that at all. And it actually makes my blood boil. So, and I'm sure I'm not the only one, but I'm going to leave it there. I want to thank you for tuning into today's episode. And, if you know someone who could benefit from hearing this episode, please do share it. So again, you'll find the show notes page for today's episode over at fertilityfriday.com/346. And if you were waiting for the last minute to jump into Fertility Awareness Mastery, it has officially arrived. So, if there's still spaces available, you will see the page still open and you'll be able to register. So fertilityfriday.com/FAM. And otherwise, have a wonderful weekend, whenever you are tuning into the show. And of course, as always, until next time, be well and happy charting.